Part 6, Breathe Easy. This lesson is 12 minutes. Dr. Kraka will discuss the value of nasal strips and some unexpected clues to the early detection of sleep breathing problems.
In our last module, Breathe Easy, I just want to summarize a few things and then make a plug for one other treatment modality that I have found to be very informative to the patient and sometimes actually begin to produce the outcomes they're looking for. In summary, the goal is to recognize that your nose is very important for breathing and that you often don't recognize that. And that as you now are taking these steps to help improve your sleep, you want to be able to ask yourself, is your breathing normal or not? And if it's not, you want to do everything you can to aggressively open up and clear the airway. The general treatment models are simple in that you're going to either use pills or sprays or washes, and the more you get into it, the more you're going to be able to see yourself what the effects are. And again, most people who will just try this in a reasonably disciplined fashion will actually see improvement within a few days or within a few weeks. More specifically, a large number of people who come to the sleep center, such as yourselves, will discover that you have either allergic rhinitis, non-allergic rhinitis, and in some cases both. Do we see patients who have none of that? Yes, we do. But they really are in a very small minority. Most people have problems with congestion, stuffiness, runny nose. Most people have attempted maybe something to see what would treat that. But very few people have gotten to the place that we call zero tolerance of trying to cure this condition so that there is no more difficulty breathing through the nasal passages. And then last, as needed, either from your own prior experiences when you've gone to ear, nose, and throat doctors, or when we evaluate you and we get you started down certain treatment pathways, we may recommend further evaluation of the airway with an ear, nose, and throat doctor. Putting all of this together, we have one other intervention which is quite dramatic, quite inexpensive, and quite remarkable. And I've done a number of research projects on nasal dilator strips, which you most commonly know as probably Breathe Right nasal strips, or as the knockoff versions in various drugstores based on the name of the drug company, like Walgreens has their own. The nasal strips are remarkable because they actually do open up the airway by creating a spring effect on the outer portions, or flanges as they're called, of the nostrils. And once they open it up, it stays open for the time that you wear them. And now we're talking about using them when you sleep. And that little effect actually produces an increase in airflow. That increase in airflow, of course, could be just what you need in the way of a general treatment to open up the nose. It could be something when you're trying to get your allergic rhinitis treated, but you haven't been able to do it yet. And in some cases, it could work for non-allergic rhinitis, but the obvious problem there is if you opened your nose up too much in non-allergic rhinitis, and now you're letting too much air in, are you actually going to overstimulate again? So that's something that you would want to watch for. But these particular treatments, the nasal strips, give you also an early jump on treatment. There was a patient in our lab last night, a long-time insomniac, for years, struggled with it, never been to a sleep center before. We met just 2 months ago, and she was describing all of her frustrations, all of her exasperations about trying to overcome her insomnia. No one had ever broached the subject that maybe it was a breathing problem. Nobody had ever mentioned that, because most people out in regular practice think that insomnia is a psychological process. In our clinical work and in our research, where we've published extensively on this, we find that most insomniacs who've had the condition a long time have breathing problems and insomnia. So one of the first things that I will do for an insomnia patient is say, how's your nasal breathing? Would you like to treat that first? Why? Because the notion that you're going to take an insomnia patient and you're going to put a CPAP mask on them sounds strange. You know, why are you giving me a mask? How is that supposed to help? I've got this insomnia, it's psychologically stress-based. How can that possibly help? So it's kind of a non-starter. We don't want to go down that pathway early with our patients. We want them to be able to see these things as they would unfold. And that's the beauty of this particular device. So this woman listened to all these explanations about, well, there's the psychological components to insomnia, there are the physiological components. She was heavily dependent on medications and had been so for years and never imagined that she could get off of them. I just saw her last night in the lab. She could not praise enough what these little babies did. She's already sleeping better. We had done nothing else because she was not ready even for testing yet. We just said, we're going to start you with some cognitive behavioral therapy for insomnia, but in the meantime, I'd like you to start with these. See what happens. And she was amazed. She was amazed. That's why she was so motivated to come back to the sleep lab, because she knew, this proved to her, and this is what I meant before about informative, this is clarifying the diagnosis for a variety of patients. She knows she's got a sleep breathing disorder now. There could be absolutely no doubt in her mind because she's used this every night for about 6 weeks, I think, or 2 months, and she's sleeping better. And she goes, there's no other explanation. There's no way you can get a placebo effect from one of these things. It's opening up the nose and you're breathing better. So that was very exciting to her, and it shows you how you can get the immediate sense of airflow improving. It is an early treatment, and it can clarify the diagnosis. And the last thing I'll leave you with on this is that we did a study with this and insomnia. And it was very interesting because we looked for a very special group. We had people who would come in who reported their major problem was insomnia. They would then report that there was nothing wrong with their breathing. So I guarantee I've got nothing wrong with my breathing. These people either said I don't snore, which was about half of them. The other half just said, no, I have no breathing symptoms whatsoever. And remember, snoring can be categorized as something that's just snoring and not necessarily a true breathing disorder. So in their minds, look, I snore a little bit, but beyond that, no, I don't choke, I don't gasp, I don't have these other things that would make me think I have sleep apnea. And then the other half I said didn't snore. So all these people said, nope, breathing is not my problem is insomnia. Virtually all of them said it's stress. This is the reason why I don't sleep well. We divided these people into two groups. One group got the nasal dilator strips. The other group just got a little bit of education, a little bit of discussion. That was it. And then we looked at them 4 weeks later. And what I want you to hear that's so interesting is that these individuals are coming to us seeking treatment for insomnia. We didn't even diagnose them with breathing disorders, although I'll give you the punchline in a minute about how we were suspicious that they had breathing disorders. So we said, we want you to use these nasal strips because, in effect, maybe there's a chance you have a breathing disorder. And if you have a breathing disorder, there is a way through which that can cause bad sleep and awakenings, which could lead to insomnia. So virtually every patient who got it said, all right, that's fine, then I'll try the research, I'll go along with you. And 75% of these people who used the nasal strip, 75% had clinical improvement in their insomnia. And that was it. There was no other treatment, nothing else. They didn't get CPAP. They didn't get advanced cognitive behavioral therapy. They just got 4 weeks of this. We thought they had sleep breathing problems because almost all of them either woke up at night to use the bathroom to urinate, or they woke up during the night or in the morning with a dry mouth. The dry mouth should be obvious from our discussion, which is they're having trouble breathing through their nose. So they mouth breathe, they have a dry mouth. So that's a very reliable sign that there's something obstructive going on in the nasal oral airway. So the nasal dilator strip then allows a person to do something early on that helps them move from the position of thinking they have a psychological problem to realizing what they've really got is a psychological and physiological problem. And that's the model at our sleep center here at Maimonides Sleep Arts and Sciences. We want people to realize that there is very likely both mental and physical components to somebody having a sleep disturbance. And it's easy to talk about psychological. We have all kinds of tools that we offer people for psychological treatments. But when you talk about physiological, you only have a few things. Work on the nose with some of the different medicines we talked about, or work on the nose with a nasal dilator strip. It's not easy to just hand somebody a breathing mask and say, oh, go try this. And not only that, but the average patient doesn't adapt to the breathing mask in like one night or 1 week. They might take a couple of weeks, it might take longer. So in summary, to finish up with the nose, this is truly the ace in the hole. This is truly the one you can use when you are trying to figure out for yourself whether or not you need to do more in this whole area to improve your nasal breathing, because you might discover just using this at night actually brings you to a place of feeling like your breathing is much closer to what normal should feel like, and very different than what you used to feel. So definitely keep this in mind as something to use every night in the early phases of your treatment, because even though you're still trying to work on those, they take time, whereas you can put the nasal dilator strip on tonight, and you can actually begin to feel some difference in terms of opening up the nasal airway. Thank you very much.